sure you're doing it that way.
That's fine.
Yeah, do it that way. Yeah, you're gonna have to answer some questions and stuff. Hi Haley, I'm your student nurse today. I'm gonna do my hand hygiene. And then can you go ahead and verify your name and date of birth for me?
My name is Haley Gilbert. My birthday is 7/13/1995.
Thank you very much. Check and make sure that matches. And how are you doing today? Any pain or anything going on today?
No, I'm good.
Okay. And then do you know where you are today?
Yes.
Okay. And then do you know who the president is?
Yes.
Who is he?
President Trump.
Okay. And then do you know what year it is today?
Yes, it's 2020.
Alright, perfect. So the patient is alert and oriented ×3 to our environment and who she is. And then I'm just going to look over your skin real quick, make sure you're not too warm or anything. Skin is warm to the touch. Now I'm going to check your head for any lumps or bruises or anything. Let me know if you have any pain. And then hair is full. No lumps or bruises on the head. Now I'm going to check your pulses here. Temporal clock fine, laterally equal, 2+. +2 on that pulse. And we're going to come down to your arms here. And your brachial pulses are 2+ bilaterally equal. And your radial pulses are bilaterally equal. And we're going to come down to your legs here. If you can lift up your legs for me, like bend your knees. Thank you. Habitual pulse bilaterally equal 2+. Let me take your shoes off real quick. Oh, that's
Could you untie the laces, please? Yeah, whatever.
And your posterior tibial pulses are bilaterally equal 2+. Then your dorsal pedis pulses are 2+, bilaterally equal. And then this is when I take the patient's blood pressure. Normal is 120/80. Respirations are 60 to 100. I mean, not respirations, pulses 60 to 100. Respirations are 12 to 20. Temperature is 96.8 to 100.4 for an adult below the age of 65. Above the age of 65 is 96.8 to 98.3. And then pulse ox is above 90%. Alright, now I'm going to inspect your skin. Skin is true color to ethnicity. Let me adjust your skin trigger here. No edema is present. And then do you think you can lift your arm up for me like this? Thank you. Do you think you can do your other one for me? Thank you. Then I'm just going to take a quick look at your hands here. Capillary refill is brisk. Alright, now I'm going to inspect your chest. Chest is a 2-to-1 ratio. I'm going to watch the rise and fall of your chest. If you can just breathe normal for me. Alright, thank you. I'm going to listen to your lungs here. Just take some normal breaths for me. Can't remember what that Now I'm going to listen to your brachiovesicular sound, so I find the angle of Louis on your chest, and I go over to your second intercostal space. And then just normal breath. Brachiovesicular breath sounds are equal on inspiration and expiration. Vesicular breath sounds, expiration is shorter than inhalation, and then brachiovesicular, vesicular. I can't remember which one it is. And then for the anterior side of the body, I use the mid-clavicular line and follow that down to the 2nd, 4th, 6th, 8th, and 10th intercostal space to listen to the breath sounds. Then I also do the apices of the lungs. Alright, now I'm going to have you sit up and turn your feet that way for me so I can listen to your back. Alright. Now I use the C7 spine and I work down to T2, T3, and then I work down from T4 to T6 to T8 to T10. Listening, using the scapulary line and anterior and posterior to that. Can you go over here?
Yeah.
If they can see me do it. Can you look your head down? And then these are bronchovesicular sounds. And then the rest on the back are vesicular sounds. You take deeper breaths. This one's gonna get a little weird. Lung sounds are clear to auscultation. Alright, and then if you can lay back down for me the way you were. I'm going to lift your shirt up here so I can look at your abdomen. Alright. Just so I can see your umbilicus. Umbilicus is in the center of the body. Then I'm going to auscultate the 4 quadrant sounds for bowel mobility. Bowel sounds are present. Now I'm going to do the vascular sounds, the renal arteries, aortic arteries, and then the iliac arteries. And for that I'll use the bell side of the stethoscope. Bruits are not present. I'm going to do the vascular assessment of the lower extremities. Temperature is warm, no edema. Alright, and then if you can stand up for me. Sorry. I'm just going to have you take a couple of steps that way. So just walk. And then turn around and come back. Gait is normal, heel to toe, head leading the body. Can you do it again? Thanks. And then shoulders are back parallel with the hips. And if you could sit down on that far cushion. And then I'm just going to have you put your hands like this, and then push out against mine. Okay, now push in. Alright. Now do the same thing with your legs, push out. Nope, like that way. Like kick out.
Oh, sorry.
No, you're good. Now pull in. Thank you. Muscle strength is a 5 out of 5. Muscle tone and mass are good. Endurance is good. No assistive devices in the room. There are no IVs or wounds or tubes. And then in my back inspection, the spine was in line. No kyphosis or scoliosis. Make sure that's it. And then I'm going to do Perla here, so you can just look that way for me, straight ahead. Perla is intact, eyes are reacted to light. Congruent when I have you look at this pen here for me, then follow it out. Follow it in. Follow it out. Follow it in. Thank you. Consensuality, meaning that the opposite eye reacts when I shine light in this one. And then convergence when I bring the light, the pen light in and out. Perla is intact. Yeah, we're good. Can you turn it off then?
Yep.